All right, today we're unpacking a topic that is just so important for anyone navigating a pregnancy: high blood pressure. It's actually way more common than you'd think, and really understanding what it means, well, that's key.
I mean, think about it. When you're pregnant, you're tracking so much stuff, right? There's the weight, the baby's kicks, your blood sugar. It's a lot of data. But what if I told you that among all of that, there's one single number that tells a story that's maybe more critical than all the rest? Yup, you guessed it. That number, it's your blood pressure. And I know it sounds almost too simple, but the implications are just huge. It really is like a barometer for the health of both you and your baby. And here's why we're really digging into this today. It's not just about those super high danger zone numbers. No. Even blood pressure that's just in the high normal range, well, that can signal a risk that honestly is so often overlooked. And knowing this can make all the difference. So yeah, let's get into it. All right, so let's start with the fundamentals. Why is blood pressure that one number we need to watch so closely throughout a whole pregnancy? Okay, first things first, let's get our terms straight so we're all on the same page. When we talk about hypertension in pregnancy, there's a really specific clinical definition. We're looking at a systolic pressure, that's the top number, of 140 or more, or a diastolic, the bottom number, of 90 or more. Those are the big thresholds that make every doctor and midwife pay very close attention. Okay, so high blood pressure by itself is one piece of the puzzle. But when you start to see it combined with other signs, well, that's when it can point to something more specific and definitely more serious, called preeclampsia. And this is a really important distinction to make. Preeclampsia isn't just high blood pressure. It's the high blood pressure plus brand new signs that the body's vital organs are starting to feel the strain. It's that second part that really changes the game. And this table just shows you how much of a whole body issue this is. Preeclampsia isn't just affecting one little part of you. You can kind of think of your blood vessels like these major highways. When they get all constricted and tight, you start to get traffic jams and problems in all the major cities. Your brain, your liver, your kidneys. And you can see here all the different warning signs for each system. Things like a headache that just won't quit, or suddenly feeling short of breath. All right, so we've got a handle on what this is and what it can do. The next obvious question, right, is who's most at risk? And that brings us to how we can spot those early warning signs. The clinical guidelines point to a few really well-known high-risk factors. Things like if you've had preeclampsia in a past pregnancy, or you already have chronic high blood pressure. Carrying twins or more is another one. These are kind of the classic red flags that every provider is trained to look out for. But what about people who don't tick any of those boxes? What if the warning sign is way more subtle? This, to me, is where the story gets fascinating. What happens if your blood pressure is just, high normal? So what are we even talking about when we say high normal? Well, okay, an optimal blood pressure is generally under 130/85. High normal is that little gray area, that zone right underneath the official diagnosis of hypertension. We're talking a top number between 130 and 140, or a bottom number between 85 and 90. So why does this little gray area matter so much? Well, get this. A huge study looked back at the data and found that people with this high normal blood pressure in early pregnancy had an 8 times higher risk of developing early onset preeclampsia. Let me say that again. 8 times. That is not a small number. It is a massive signal that's basically been hiding in plain sight. Okay, so if you find out you're at a higher risk, maybe you have one of those big high-risk factors, or even just a couple of the more moderate ones, what can you actually do? Well, it turns out one of the most effective tools we have for prevention is something really simple: low-dose aspirin. And listen, this isn't just some casual suggestion. It's a really strong recommendation, and it's backed by solid evidence. The Association of Ontario Midwives Guideline puts it super clearly. Low-dose ASA reduces the risk of preeclampsia. It's just a simple intervention that can have a huge positive impact. But what if, even with preventative measures, high blood pressure issues still show up later in the pregnancy? Okay, that brings us to the next phase, the management plan. Now, this is where the data gets super clear and helpful. It boils down a really big clinical decision. So if you're at 37 weeks or later, what's the safer bet? Induce labor now or wait and see? Well, a major trial called the HYPOTET-I trial gave us a clear answer.
For the parent, inducing labor actually lowers their risk of getting severe high blood pressure. And here's the crucial part. It doesn't increase the C-section rate, and it doesn't change the outcomes for the baby. It's a clear win for induction in this case.
But the story doesn't just stop once the baby arrives. Not at all. High blood pressure can be a risk during pregnancy, for sure, but also after. So we have to look beyond the birth.
Okay, this timeline is just so important for new parents to get. Your blood pressure doesn't just magically snap back to your old normal. It actually has a pretty predictable journey. It usually drops right after you give birth. But then, and this is the part everyone needs to know, it often starts to rise again and can actually hit its highest point around days 3 to 6 after the birth. That is such a critical time to keep an eye on things.
And when we talk about risk, we have to look at the whole picture. The data is consistent and clear. Black pregnant people experience higher rates of preeclampsia. But it is absolutely crucial that we understand why. And the clinical guideline is very explicit about this. These disparities are the result of structural racism and inequities in care. They are not due to biological differences. And that is a vital distinction to make.
So, after going through all of this, what's the big takeaway? It's that your blood pressure is telling a story. It's a story that unfolds from that very first trimester all the way through those hazy postpartum weeks. It's so much more than just a number. It's a whole narrative about your health and your baby's health. And so the question I want to leave you with is this. Are you, and is your care team, truly equipped to listen to that story?